Hello, and once again, welcome back to Medical Minds, where we bring you the latest medical insights and evidence based health advice. Today, we are tackling a hot topic that many fitness enthusiasts and health conscious individuals often overlook: protein intake. While it is true that protein is a cornerstone of a balanced diet, providing the building blocks for muscle, tissue repair, and overall function, overconsumption can lead to some hidden health risks. In this video, we will unpack the science behind the high protein diets, explore recent studies, and highlight why more is not always better when it's come to protein. Let's dive in. Protein is a vital component of our diet, consisting of amino acids that are building block of muscles and tissue. It plays a crucial role in many physiological functions, including enzyme production, hormonal balance, and immune function. The recommended dietary allowance for protein is about 0.8 grams per kilogram of body weight per day for adults. However, many people, especially those following high protein diets like keto, often consume significantly more. While protein is undoubtedly important, too much of a good thing can be harmful. Recent research has shown that high protein diets, particularly those relying heavily on animal-based sources, can lead to several health issues. Number 1 is kidney strain and damage. High protein diet increase the workload on kidneys. When protein is metabolized, the byproduct include nitrogenous phase primarily in the form of urea. If protein intake exceeds what the body requires, the kidneys must work harder to excrete these byproducts. Over time, this increased workload can lead to kidney damage, particularly in individuals with pre-existing kidney conditions. A study published in the journal Nephrology revealed that individuals who consistently consume more than 2 grams of protein per kilogram of body weight per day had significantly higher risk of developing chronic kidney disease. An often overlooked consequence of excessive protein intake is its impact on bone health. Diets high in protein, especially animal protein, can lead to a higher acid load in the body. The body in turn may pull calcium from bones to neutralize this acid, potentially weakening bone density over time. According to recent research published in American Journal of Clinical Nutrition, a high protein diet was associated with increased calcium excretion in urine, suggesting that prolonged exposure could lead to bone demineralization and increase the risk of osteoporosis, particularly in older adults. Next is heart health concern. High protein diets often comes with a higher intake of saturated fats and cholesterol, especially when sourced predominantly from red meat and processed meat. This can elevate LDL cholesterol levels, contributing to the development of cardiovascular disease. A comprehensive 2022 study in the European Heart Journal demonstrated a direct correlation between long-term consumption of red and processed meat and a 30% increase in the risk of coronary artery disease. The researchers emphasize that while protein is necessary, the type and source matter greatly. Proteins-heavy diet often lack fiber, a crucial nutrient for maintaining gut health. A deficiency in fiber can disrupt the balance of gut microbiota, leading to issues like constipation, inflammation, and reduced diversity of beneficial bacteria. A recent investigation in gut microbes showed that participants on high-protein, low-fiber diet experienced significant alterations in gut microbiome composition, which has been linked to a higher risk of developing colorectal cancer over time. Certain groups are more vulnerable to the dangers of excessive protein intake. Individuals with pre-existing kidney conditions. For these individuals, even slight increase above the recommended protein intake can accelerate kidney damage. Older adults, excessive protein intake may deplete calcium from bones, increasing the risk of osteoporosis and fractures. Athletes and bodybuilders, although they require more protein, excessive intake without proper monitoring may lead to long-term complications like kidney strains and cardiovascular issues. The Academy of Nutrition and Dietetics recommend that protein intake should not exceed 2 grams per kilogram of body weight per day for healthy individuals. Exceeding this amount consistently increases the risk of health problems we have discussed. If you have pre-existing medical conditions or concern, it is best to consult with a healthcare provider or dietitian to determine your optimal protein intake. If you are aiming to increase protein intake safely, consider diversifying your sources. Lentils, chickpeas, tofu, and quinoa provide high-quality protein while being low in saturated fats and high in fiber. Opt for lean sources such as chicken, turkey, and fish. Fatty fish like salmon offer additional heart-healthy omega-3 fatty acids. Low-fat yogurt, milk, and eggs are excellent protein sources that also provide essential vitamins and minerals. So, while protein is vital for our health, moderation and variety are key. Prioritizing balanced meals and considering diverse protein sources can help you reap the benefits without the risk. Always consult with a healthcare professional before making significant dietary changes, especially if you have pre-existing health conditions. If you found this video helpful, please give it a thumbs up, subscribe to Medical Minds and click the notification bell for more medically accurate and research-backed content. And remember, your health is your greatest asset. Take care of it wisely. Thank you for watching and see you next time.